If I wanted to send some of the blood in my right atrium to my intestines and back, this blood would obviously have to pass through the pulmonary circuit first. It would pass to the right ventricle, to the pulmonary trunk, to the pulmonary arteries, which would carry this deoxygenated blood to the lungs, and in the pulmonary capillaries, gas exchange would occur, so that oxygenated blood would return through the pulmonary veins, through the left atrium, and then the left ventricle would pump this oxygenated blood first into the ascending aorta, then the arch of the aorta, then the descending aorta, first its thoracic portion, and then the abdominal aorta. The abdominal aorta gives rise to a number of unpaired arteries. Posterior to the celiac trunk, at the position of the first lumbar vertebra, is the superior mesenteric artery, which then proceeds through the mesentery and reaches the intestines. It sends out a number of intestinal arteries which reach the small intestine, and a number of branches which reach the cecum, ascending colon, and portions of the transverse colon. And so the superior mesenteric artery supplies all of the small intestine and much of the large intestine. Around the position of the third lumbar vertebra is another unpaired artery which departs from the abdominal aorta, known as the inferior mesenteric artery. It services a portion of the transverse colon, the descending colon, the sigmoid colon, and a portion of the rectum. And so the superior and inferior mesenteric arteries provide oxygenated blood to the small and large intestines. Throughout the capillaries of the intestines, gas exchange converts the oxygenated arterial blood to the deoxygenated venous blood, which then drains from the intestines. Many small veins fuse to form the superior mesenteric vein, which drains the small intestine, and the ascending colon and portion of the transverse colon of the large intestine. And other veins fuse to form the inferior mesenteric vein, which drains the distal portions of the large intestine. Now, these two veins do not empty into the inferior vena cava. Instead, the inferior mesenteric vein fuses with the splenic vein, and these fuse with the superior mesenteric vein to form the hepatic portal vein, which carries deoxygenated blood from the digestive tract directly to the liver, so the liver can process the material which has been ingested. From the hepatic portal vein, the blood will empty into sinusoid capillaries as it passes through the lobules of the liver, and from the lobules, blood drains into the central veins located in the center of each lobule. These central veins empty into the hepatic veins. The hepatic veins empty into the inferior vena cava, which then returns this deoxygenated blood to the right atrium of the heart.